How do behavioral problems compare and contrast with signs of exceptionalities? Similarities that will often make it hard to tell the difference are meltdowns, issue with sensory processing, and struggling socially, because both students with behavioral problems and students with exceptionalities tend to have these symptoms. So if a student gets really overwhelmed and the classroom gets hectic or wants to be alone more than work with groups, these are potential signs, as well as students struggle to keep in their emotions, and that often leads to an outburst of all their emotions at once because they do not know how to positively express those. Differences are really important to be able to spot, so as a teacher, it is essential to study up on exceptionalities and behavioral issues. One sign that you could use as an example would be if you're looking for if a student might have behavioral issues or autism. A student with autism might have an obsession with one certain topic. That's all they really talk about. That's one thing that they really connect with. They really understand this. They want to research it whenever possible. And also, students with behavioral issues tend to get violent and aggressive when they are overwhelmed or they don't understand something, whereas students with exceptionalities just tend to get upset, and you will be able to see that difference in the classroom. Ways a teacher can tell are keep the student busy and engaged as much as possible and make sure to include their learning styles and how they learn best in the lesson plan. This will help because students with behavioral issues will most likely become more engaged, have a more positive attitude, and maybe even be more likely to work with groups, where students with exceptionalities will be excited and intrigued, but they're still going to struggle because that exceptionality doesn't just go away because they're feeling good about something. Also, ask parents who want to be involved to observe their children at home and give them signs to look for so they're not just pulling at random things, and see how they act outside the classroom because these could be really big signs that you're missing that are happening every day just at home. And chances are parents are already observing their children's behavior in some ways, so they might be able to tell you things right off the bat that are going to be really helpful. Ways to help yourself and the student are stay patient with the student. You're going to get more information if they feel they can trust and confide in you, and you're going to get information of how they feel emotionally and mentally, which might be huge in discovering what is affecting the student exceptionalities or behavioral issues, because a lot of the symptoms you can't see physically. So when they come up and tell you these things, these are going to be huge, as well as observe the students and keep notes. It's going to be really helpful to be able to go back and maybe see things that you didn't notice at first. And it's also going to be helpful if there needs to be an IEP involved to be able to have examples to go off of. And get personal with the student. Make sure you know them and they feel heard, but stay professional and make sure you know that line and the student knows that line as well.